And good morning and welcome to Health Talk on AM 1270 and 96.5 FM KXBX. It's Health Talk. Paul Thomas, Bill Kearney, NorthLake Medical Pharmacies. And Bill, the rain out there is it wreaking havoc yet, or is it still pretty mild?
You know, I don't know how much we got last night. I live
seemed to rain a lot
out by Canocti, and it was raining pretty heavily. Mm-hmm. I forgot to look in the creeks when I came in this morning, but I'm on my way up to Eureka to see my new great-grandson.
Congratulations.
Thank you. Yes. 7 pounds, so many ounces. Grayson is his name.
Grayson, wow. I met a kid named Grayson over the weekend for the first time.
Oh, did you?
It must be a popular name.
I was kind of feeling sorry for my grandson. Hey, Grayson, you're just going to call him Gray? Hi, Gray.
Yeah,
is that your first or last? No,
Grace. I hope he doesn't get called Grace.
Yeah, beautiful. Yeah. I have a granddaughter named Grace from one of my daughters. So I don't know what'll happen, but anyway, we're going to go up and see this new marvel of life, and then come back and getting ready to go to Hawaii next week. So
true, yes.
We recorded a show yesterday, which will be on next Wednesday, and then we're only going to be there a week. So it's my 43rd wedding anniversary.
Wow!
So looking forward to gimping.
So many milestones.
Huh?
So many milestones.
So many milestones.
Yeah.
And so I'm looking forward to getting over there and maybe exercise this broken leg a little bit, doing some snorkeling and.
It just sounds so weird. Exercise the broken leg. It's your recovery turnaround time is phenomenal. It's you should be in the Guinness Book of World Records.
Yesterday, I didn't even use a cane. I got up and I had a friend of mine come for coffee, and I said, "Look, I'm not even limping." By the end of the day, I was not doing well, but and I see I forgot my cane today. It's in the car.
You had the chauffeur today, Dan dropped you off. So,
but I'll be driving. She's never driven my car before today, and so she's had a couple of parking lots to pull in and out of. And, it's one of those that start with the button. I forgot to tell her that, and then so she gets in and she knew it was the button, but it wouldn't start because you have to have your foot on the brake. So. She was just ready to call me out of physical therapy, and she saw the little reading on the GPS thing saying, put your foot on the brake, stupid. No, dear, I know it didn't say stupid.
She never says it.
No. So, but she's doing just fine. So, anyway, this is Health Talk. We're in a rainy day right now. And,
by the way, Bill, just real quickly, don't mind me taking pictures of you during the show. They're for our website page that we're developing for NorthLake Medical Pharmacy and for Health Talk here. So,
I was afraid that maybe you were just putting them up on your bulletin board at the house and throwing darts at them.
Send them out to TMZ and Access Hollywood.
Well, we need some marketing, so that's great. We're going to do some fun things with the website and have some pods, I guess, that we can listen to eventually.
Yeah, do some podcasting a little bit in here shortly for our listeners. So if you guys miss a show on Wednesday, we, in the near future, will have them available on the website through our YouTube channel. So we'll upload them into to YouTube. Speaking of YouTube and videos, I actually finally saw your, I guess it's your television commercial you have off your website, or is that was very well done.
Well, thank you.
Yeah, enjoyed watching it.
Yeah, I bet you did. So you always get some laughs. That's the only thing that keeps you awake is some of the crap that goes on.
Man.
I was just talking to, I think it was Mike. It was either Mike or George I think it was Mike about our Christmas show. That how entertained.
We were a little bit overly entertaining that day.
Over the line, But
I swear there was no eggnog.
No, there were no brandy, no eggnog, no nothing.
Just the thought of it was enough.
We were high on life on that day. So, today we're going to be talking about your life and some of the advances in medical technology and the difference between a couple of products that are used for the same thing and why one is different than the other. First, we're going to talk a little bit about that. And the two drugs that we're comparing is ibuprofen versus acetaminophen or Tylenol. And a lot of people want to know, is there much of a difference between a bottle of Advil, which is ibuprofen, and Excedrin? A lot more than you thought, actually, and it's time that we really kind of made that clear, because we see these as combinations in medications all the time. Despite the litany of different brand names and packages, there are basically two major types of over-the-counter painkillers. Acetaminophen is found in a bottle of Tylenol or Excedrin, and non-steroidal anti-inflammatory drugs, which we call NSAIDs, which is the abbreviation for steroidal anti-inflammatory drugs, and a broad class that contains ibuprofen, which is Advil, naproxen, which is naproxen, and Aleve, and then aspirin. There's three different kinds of chemicals, plus acetaminophen, that we talk about that are really different, and you need to know what the difference is. So the purpose is going to be looking at acetaminophen and ibuprofen, although those other non-steroidal anti-inflammatories can be the same. It turns out that there's a lot more difference between them than we really thought there were. Of the four major painkillers, acetaminophen and anti-inflammatories, the first acetaminophen was discovered in the 19th century, and it wasn't until 1950 that it became a safe medication used to relieve pain and reduce fever, and it was soon marketed as Tylenol by 1959. Now, some of you weren't even born then, but it's become available over the counter in the United States, despite the later start in this country. And it's now widely used as a painkiller all over the world, both with prescription and over-the-counter. Ibuprofen, on the other hand, is the second youngest of three major over-the-counter non-steroidal anti-inflammatories that were created in the 60s and marketed in this country in the 70s. And by 1984, it too would become an over-the-counter stateside. So ibuprofen, just by virtue of being an anti-inflammatory, can reduce bodily inflammation, and acetaminophen, by comparison, has little or no anti-inflammatory properties, meaning that if you're in pain because of a swollen ankle, you're probably better off with a bottle of Advil than you are Excedrin. Now, you ask why. Well, the ibuprofen, the non-steroidal anti-inflammatory, actually treats the reason you're having the pain, where the acetaminophen or Tylenol actually is what we call an analgesic, and it stops the pain. It just tells the brain it doesn't hurt, but it doesn't do anything about the cause. The ibuprofen reduces the cause, and when the cause is eliminated, the pain goes away. Sometimes you take both. You take the anti-inflammatory until it's not causing that hard pain anymore, but you may still have some residual pain, and at which time you can start taking the Tylenol. So, as reported before in the Medical Daily, a bottle of the Excedrin may not prove as effective for different kinds of relief. The authors quickly came to the conclusion that acetaminophen was ineffective in the treatment of low back pain and provides minimal short-term benefit for people with osteoarthritis. Ibuprofen, meanwhile, can provide some relief for acute episodes of both. Now, I know what the classification is, and I know what they're saying, yet I can tell you I have literally thousands of patients that take acetaminophen or Tylenol for low back pain and extra strength, and it works for them. Now, there may be something else besides inflammation of a nerve or inflammation of a disc or something that's causing that, but they still take it, and it's been effective. So there was a review in evidence-based nursing that found that a child's fever was more effectively calmed down by ibuprofen than acetaminophen, though there didn't appear to be any substantial difference in pain relief. Tension headaches, ibuprofen, cramps, ibuprofen, and other NSAIDs. Why did that work? And there's only clear-cut advantage of Tylenol or acetaminophen that they would have over ibuprofen is with the very young. And, of course, if you're aware, the very young can't take aspirin-like products or aspirin because acetaminophen is the only drug that you can use with infants, when ibuprofen shouldn't touch the tongues of anyone under 6 months of age or younger, and aspirin is explicitly discouraged by anyone under the age of 18 due to its risk of causing a rare condition known as Ray's syndrome. The only problem I have with that is people my age, and even younger, were given aspirin because that's all that was available when we grew up.
I was given aspirin.
Yeah, and look what happened to us.
I know, look at us.
Yeah. You've actually got pictures that are the living proof. So while ibuprofen may have more versatility and punch to it, it's been generally believed that acetaminophen is the safer option. That's till recently, because a 2015 review published in a medical journal this past January found the risk of adverse events for acetaminophen in relation to dose wasn't any better to those observed with non-steroidal anti-inflammatories. So we believe the true risk of an acetaminophen prescription to be higher than the currently perceived clinical community. And the authors concluded how these risks manifest and how they work and how they're effective against you vary between the two, with acetaminophen linked to liver toxicity and ibuprofen capable of causing gastrointestinal bleeding and kidney damage. And there are other things that combine with that. Acetaminophen with alcohol can also lead to liver toxicity. Acetaminophen just in more than 3.5 grams a day can lead to liver toxicity. And you have to remember that some of these acetaminophen tablets or capsules are 650 milligram. So 5 of those would be over the amount of acetaminophen that you would take to keep your liver from being toxic from too much of that chemical. So a broad takeaway here is that there is, one, that there's no perfect medication, no matter how wondrous it is or great it is, if it's short-term or long-term benefits. For instance, though NSAIDs may trump acetaminophen in effectiveness, they also may slightly risk your ability or your chance of having a heart attack and stroke. And nearly 500 Americans are estimated to die from acetaminophen overdoses every year. So none of this means you shouldn't take a pill for your headache when it comes roaring by, but it just means be aware of the pill's potential strengths. As for what bottle you should grab off the shelf, well, provided you're not suffering from any sort of specific allergy or underlying kidney complications, the ibuprofen probably will give you the best bang for your buck. And to be honest with you, you should have 2 of those, one of each of those products, and it wouldn't have to be ibuprofen. It could be naproxen as an anti-inflammatory, or naproxen. And those anti-inflammatories, even aspirin, works very well. So again, it's risk versus benefit. You've heard us talk about risk versus benefit a lot, and what we should do in order to evaluate these drugs before we take them. It's an individual decision, because our standardized health, or our health as it stands today, for each of us is different. And what could be a toxic thing for me may not be for you. If you had already a bad problem in your gastrointestinal tract, then the non-steroidal anti-inflammatory would not be the choice. However, I happen to, because I've had colon cancer, happen to be one that takes a non-steroidal anti-inflammatory along with a PPI, which is a proton pump inhibitor, like Protonix, or like Prevacid, or omeprazole, or Prevacid, Prilosec, also Nexium. Those are all proton pump inhibitors who inhibit the acid from being produced in your system. So that protects me from any gastrointestinal side effects I could have from the Celebrex. And also, the Celebrex is what we call a COX-2 inhibitor, COX-2 inhibitor. And what that does is it keeps the minimum amount of acid being produced away and doesn't actually let us have enough of the acid to do us any harm. So just keep in mind with non-steroidal anti-inflammatories and with acetaminophen, there are toxicities for both of those. When those came on the market as over-the-counter drugs, they came at a lower strength. And also, when they came on the market, PPIs came on the market too, like Prilosec and omeprazole and Protonix and linanaprost and the generic names for a lot of those non-steroidal anti-inflammatory or proton pump inhibitors. And they made it a lot less expensive. Now you can buy those products in lower strengths over the counter and not see a physician. That's when we get into trouble, and that's what I was afraid of when these products came out on the market over the counter. You can get ibuprofen over the counter in 200 milligrams. You can get ibuprofen on prescription from 200 to 800 milligrams. The maximum amount of ibuprofen that you should take is 3,200 milligrams, which would be 4 of the 800 milligram tablets. If you try to do that with a lower dose, you end up taking 16 tablets of 200 milligram at a pop, and before the end of the day, you're up over 50 tablets, and half a bottle of ibuprofen is gone. With acetaminophen, that level is 3,500 milligrams. So if you're taking extra strength acetaminophen, 500 milligrams, it doesn't take long to get to 3.5 grams. That's 7 tablets. So, and that's the total, not at a time, that's the total in a day. So, and then if you're taking any other kind of cough syrup or cough suppressant or over-the-counter medication for colds, antihistamines, sleeping, that has the drug in it as well, then you're going to end up taking toxic amounts of that. We still call physicians on a daily basis of prescribing a painkiller that's an opiate that also has acetaminophen in it, and the amount of toxic drug is really the non-opiate drug, the acetaminophen, opposed to the opiate that's oxycodone or hydrocodone. So we see this all the time, and it's hard for physicians to get their arms around it and make sure that we watch these toxicities. And even as the drug companies try to come out with drugs that are on the formulary many times and have reduced amounts of acetaminophen, it's not enough sometimes to keep you from overdosing, especially if you're getting it over the counter and you're adding over-the-counter medications to it as well. Spicy foods, Paul. You like spicy foods, right?
I do.
And I do too. In fact, one of the gifts my daughter-in-law gave me was a jar of hot dill pickles and hot peppers. Ooh. And I love them. Mm. And I last night I have this strange. I drink a cocktail maybe once or twice a month rather than a glass of wine. Last night was a bad day, and I said, "Yeah, I'll have a cocktail." So it was a Tanqueray or something, and I put a hot, spicy dill pickle in there, and a hot pepper, and it just flavors it just a little bit. But boy, and that's where I'm going to Eureka today. When I bit into that dill pickle, which is usually frozen, and my eyes watered, and the first thing I wanted to do was to rub my eyes with my finger, and that's how I put the thing in there, because I grew some jalapenos, habaneros actually at home, and I had all of my grandkids were there for Thanksgiving, and so I've got grandsons that 13 years old and 15 years old. We can eat anything. So both of the grandsons from two different families said we're going to eat
give it a shot.
The habaneros. Yeah.
Bill, we got a call.
Okay. Good
morning. You're on Health Talk.
Oh, thank you, Bill. I want to give you an attaboy.
Okay.
Number one, I can't believe that you're still surviving with your health record.
Thank you.
You have an employee there, Steve, who has absolutely been a lifesaver for me. We've had some difficulty trying to get our Part D plan straightened out and still haven't received a card from him. But he's been able to go through and get my eligibility all straightened out and whatnot. And he went way above and beyond what I think. So I just wanted to let you know that he's doing a great job.
Well, I really appreciate hearing that, because Steve has really had to step up to the table with me being out with this broken leg. And even if I'm there now, it's 3 or 4 hours, and he's there saying, you got to get home, boss. You got to get home. You're only supposed to be here for 2 hours. And I've seen him work with people like that. He has a genuine heart for people. And I just had a talk with some of my employees this week about, I really appreciate your feeling for the customer, because that's what makes it able for me to go home after 3 or 4 hours here, and I feel like it's your pharmacy as well as mine. And we forget that sometimes, and we've had, and Steve is one of those guys that helps put everything back together, and we've had computer problems for the last 2 weeks. And you come into work and you think everything's going to work just fine, and it doesn't. And he's my go-to guy, him and Cindy, of getting the computers up and working. And it's tough when you're underneath that counter and you're talking to computer companies and they're treating you like you don't know anything. And Steve's able to do that and still work with the customer. And we have bad days, we all do, but he'll appreciate hearing that. And I know he highly respects you. But he's one of those individuals that don't come around very often, that really have a feeling for their clientele, and I'll certainly pass that on, because I highly respect you, and I know he does too. So. Well,
I was very impressed with the way he went about it and everything. And one of those days that he helped me, the computer was down and there were people just door to door, and he was trying to get other things done, and he took the time to do me personally, so that was great. And also the ladies in there, they do a fantastic job. So just wanted to let you know.
I love hearing good stuff, because we hear all the bad stuff, but we don't get the good stuff very often, so I appreciate it. Thanks for calling.
Okay, thank you. Bye-bye.
Bye-bye. We're going to take a break here, Paul, and then we'll come back and talk about those hot pickles. Did you know that according to the American Heart Association, heart disease is the leading cause of death among men and women in the United States? Hi, my name is Bill Kearney, pharmacist and owner of NorthLake Medical Pharmacies. The good news about the heart is that a healthy lifestyle can prevent the vast majority from the disease. There are risk factors that you can't change, such as being male, being older, and a family history of heart disease. But other risk factors that you can change. Smoking. Do you know that 30% of all the deaths from heart disease are directly related to smoking? High cholesterol. Limit your fat intake and limit intake of cholesterol. Increase your intake of vegetables and fruits. Exercise routinely and drink 32 to 64 ounces of water daily. When these things are done in combination, they can drastically reduce your chance of developing heart disease. While these procedures are very important for people with risk factors, they're even more important if you've had a heart attack. NorthLake Medical Pharmacy with 2 locations for you, and now free delivery to Lakeport, Nice, Upper Lake, Lucerne, and now Kelseyville, the Rivieras, and Buckingham.
I'm Dr. Jackie Duncan. When my daughter asked me to come to her school to talk about my job, I wasn't sure if clinician scientists would be very interesting to her classmates. But when I told them that my research might prevent their grandparents from losing their sight, that got their attention. I'm working with the American Health Assistance Foundation to find a cure for macular degeneration, a debilitating eye disease. Macular degeneration is a leading cause of vision loss for people over 60, affecting over 11 million Americans. It's important to let young people know how to take care of their sight. I told the children about ahaf.org/kids, a website created just for them. Here, families learn about the disease using interactive games, stories, and other activities. Visit ahaf.org/kids or call 1-800-437-2423 for free information about macular degeneration. That's ahaf.org/kids or call 1-800-437-2423 for free information and resources.
We live in the age of mobile devices. They keep us in touch and informed. They help us work and play. And they all use rechargeable batteries. But these batteries aren't just rechargeable, they're recyclable. And more than 50,000 free drop-off locations across North America make it easy and convenient. We all enjoy the freedom that mobile technology gives us. Let's accept the responsibility to pass that freedom on. Find out how you can answer the call to recycle. Visit calltorecycle.org.
Hi, I'm Mia Hamm. As a professional soccer player and a future soccer mom, I know how fun and rewarding sports can be. I also know how frustrating it is when you're sidelined by an injury. So I've teamed up with the American Association of Orthodontists to ask young athletes to play it safe when playing sports. I spent years training to become a world-class athlete. I know what it takes to become an expert on the field. Orthodontists understand this too. They're experts in their field, helping kids and adults obtain healthy, beautiful smiles. They want to help athletes prevent injuries and stay in the game. It only takes a second to get hurt, and too many athletes are risking injury because they're not properly equipped during games and practices. Wear the right protective gear, like mouth guards, face masks, and helmets. Your first line of defense against preventable injuries. Play it safe, achieve your goals, and keep smiling. Visit braces.org.
Okay, we're back.
Hey, we're back. And,
tell me about them hot pickles.
Well, you know, I
love pickles.
So
and I love it hot.
I bit into one, and it was very hot.
Very hot.
And so what did I do but pick it up?
Sure.
And rub my eye. But I was talking to you about my grandsons.
Yeah, they're gonna.
They were eating the habaneros, and they were
eating them raw.
Raw.
Oh,
no problem, Grandpa. I can I can eat these down like anything.
Not even pickled, just raw off the.
just raw off the plant. Washed them up, and so.
Seeds and all?
What seeds and all?
Oh boy!
And then one of them rubbed their eyes.
Oh yeah, I've done it.
And I had to get some saline solution and put in their eyes so they could. I said, "Now go wash your hands like I told you to originally." Well, here's Grandpa. Boys are gone. Here I am having my one drink in a month and rub my eyes. And
it's
gosh,
horrible.
it was hot.
It's horrible.
And I loved the pickles and I loved the pepper that was in there. The seeds were but boy, you have to be careful.
Well, I got one better for you. Actually, two better for you. With peppers and handling them improperly. Because I used to make salsa for Christmas, and I was dealing with jalapenos and habaneros and so forth. And one year I got I think it was a jalapeno seed in my eye. It as I was scraping the seeds out, it flipped up. It just went right into the corner of my eye. So, getting the thing out wasn't too difficult, but I swear, I probably was in pain in that eye for at least an hour. At least an hour. And
lucky.
I was rinsing
You're lucky
it.
You didn't
I filled an entire bowl of water just so I could soak my head in it continuously and have my eye open in the water
that probably saved your vision.
It probably did. Well, and the fact that it went into the corner too.
Yeah.
I think if it would have gone in the in the front part of the eye, it would have been really bad for my vision. But I got it out pretty quickly. But the residual burn just kept on and kept on.
Yeah, it keeps on giving.
It does, yes. And then the other year, this was probably the year before, maybe 2 years before, I had I hadn't learned to use gloves, rubber gloves, when you work with the peppers. When the one went in my eye, I was wearing rubber gloves, but this year I did not. And nature called.
Oh my God!
I went in to use the restroom and went number one. Came back out a few minutes later, and it just burned down below like you wouldn't believe. And I don't know how. Somehow I stripped out of my clothes and was in the shower within like 30 seconds, just trying to, wash it off. And I learned quickly you gotta use gloves and eye protection.
Yeah. Well, the purpose of me bringing this up was about how it could help you live longer, but not the way that you're using it or I was using it. And there was a study that was published in the medical journal of BMI that suggested that spicy food may be good for you. And I know your wife uses it for metabolic reasons.
Because she swears by it.
And there's evidence that supports that. But the study used information from a database of nearly 500,000 people in China. And believe me, I've been to China and I've been to Korea and Vietnam. And the hot, spicy foods they eat will put you right down to your knees. And after about 7 years had passed, it was found that in comparison to those who seldom ate spicy foods, those who ate spicy foods 1 or more days a week had a 10 to 14% reduced risk of death over the course of the study. And it's promising because, especially for spicy food lovers, however, it's difficult to draw a cause and effect relationship with survey-type research. So in addition, an accompanying editorial points out that researchers didn't account for several dietary vegetables or variables that could have influenced the final results. So, and in the Far East and Asian countries, they do eat a lot of vegetables and a lot of fish, and that could have added to it because we didn't exactly do a double-blind study. But this study adds to a growing body of research suggesting that spicy foods, of which a key ingredient is capsaicin, which is the red pepper, is derived from chili peppers. And they may have a number of healthy qualities, and those include anti-inflammatory and anti-cancer properties, and perhaps attributes that contributes to the weight loss, which is why some other people pick up the use of those. So we're just learning new things about old products that we have that'll utilize new uses for these things, and that's one of them. Our number is 262-5252. So this is your last chance to call me before I leave next week, because I have a recording that we're doing next week. So don't be frustrated if you call and Paul doesn't answer, because he never interrupts my recording. He wasn't there. So
there.
The FDA has strengthened warnings on pain medications and manufacturers of non-steroidal anti-inflammatories, which we were just talking about, to strengthen the label warnings that these can cause an increase of heart attack and stroke. Now, I don't want you to panic about this, and we've talked about this before, and I'm not necessarily on the same page, and mainly because I take a non-steroidal anti-inflammatory, and without me taking that to reduce the pain, I would have to be taking an opiate or something like that, and I refuse to do that. But commonly used to treat the pain and inflammation, such as headache for arthritis pain, it includes the drugs we talked about earlier, ibuprofen, Advil, Motrin, Celebrex, aspirin. Research indicates that serious side effects such as a heart attack or stroke can occur as early as the first weeks of regularly using an NSAID, and the risk may increase the longer it's taking. Taking non-steroidal anti-inflammatories at higher doses may also increase the risk of a heart attack or stroke. And evidence suggests that some, such as naproxen, may not be as harmful as others, but more research is needed to confirm that. Now, the naproxen, if you've seen this advertisement of a guy, a person, a gal or a guy taking acetaminophen, and they're taking it 4 or 5 times a day, and here's this person that is going to take naproxen, and which is Aleve, and they're only going to have to take it twice a day. Well, and they're talking about, well, no, I'm not going to take acetaminophen because I have to take it so often, and I'll take this drug. Now, remember, the drug that you buy over the counter as a Aleve or a generic of that, naproxen, or over the counter as Advil or the generic of that, which is ibuprofen, that for people that are healthy, as well as those who have cardiovascular disease or they're at increased risk for serious side effects, I wouldn't worry about it so much. In my estimation, and I've studied this quite a bit, and I'm not telling you to go against what your physician says or cardiologist, because I'm not a physician, but people with cardiovascular disease have a higher baseline risk of a heart attack or stroke, and this total risk is higher than that of healthy individuals. So say, for example, that the higher the risk of a heart attack or stroke, the higher the baseline of medication. And say people have found that, and we have found that studies, people who take NSAIDs after a heart attack have a higher risk of a repeat heart attack than those who don't take NSAIDs. Occasionally a use of a non-steroidal anti-inflammatory, even if they're in good health, it's unlikely to cause harm for general pain relief. You might consider taking acetaminophen or Tylenol instead, which doesn't increase the risk of a heart attack, to help ease muscle or joint pains, or other therapies such as hot or cold packs before taking a non-steroidal. If you need to take one, ask your doctor or pharmacist, find the right one for you and minimizing your risks. If you're taking an NSAID and you notice any signs or symptoms of a heart attack or stroke, such as chest pain, shortness of breath, weakness in one part of the body or one side of the body, or sudden slurred speech, get medical attention right away. And all I'm saying to you is there was a drug called Vivox that was a COX-2 inhibitor like the Celebrex I'm taking. And guess who was using it as an anti-inflammatory after cardiac surgery was done? And it was a lot of heart surgeons that were using Vioxx. And they found out that it caused abnormalities, and they took it off the market along with one other COX-2 inhibitor. They couldn't find that Celebrex or Siloxicab was doing the same thing, and they left it on the market. At that time, I was taking 800 milligrams of Celebrex a day because it was prior to my last back surgery, and I was in so much pain I could hardly move. Although they had 400 milligrams and 800 milligrams on the market of Celebrex, it wasn't advised. And I was taking it routinely, and it was the only thing that would stop my pain. So I went to my cardiologist, who happened to be Dr. John Minotti, and he ran every kind of cardiac test he could on me to see if there was any heart damage or valve damage, and there wasn't any. So I went back. I had heart surgery, or I had back surgery, where they had to re-break my back in 2005, and that eliminated that severe pain that I had, although I still had pain. So I went back on Celebrex at 1 a day instead of 4 a day, and I'm not able to correct the pain where I don't have it at all, but it has substantially reduced the amount of pain that I have, and now they have a generic on the market that would help also, and at a lot less cost than the brand name was. So we're telling people that where they have to take a non-steroidal anti-inflammatory, that's probably the best. It's also the most expensive. It put me in the donut hole the last 2 years in a row because there wasn't a generic available. And we're thinking that it may be easier now. Speaking more out of health than something else, I was on a board of directors meeting this morning at the co-op I belong to, and it was quite early. And at the end of the conversation this morning, we talked about Aetna Medicare D plans. And the people that are on Medicare D plans and Aetna, you may find your provider of healthcare services, your pharmacy, not wanting to do your prescriptions anymore because they're losing so much money. I, for example, have that in my family. Of one medication was $18. We had to change it to another medication. If you are somebody on Aetna D plan and you're finding that there's a loss and the pharmacy is approaching you about the loss, we're trying. It isn't just community pharmacy, independent community pharmacy. It's all providers. It's not a good plan for us. We're putting the heat on. We have 100 or 1,500 stores in my co-op all over the United States. We're putting the heat on Aetna to change this reimbursement as quickly as possible, and so are the major chains because they're not doing well with this plan either. So, just because you're in a plan and you're locked in it for a year, maybe you don't like it, you want to change that. If you do, you can't change in the middle of it, but we can get some alternate medications for you that will probably let you get by this year, as I'm trying to do, and not make that mistake again. So, Paul, you're not the size to, although you're fighting your weight, to have a bypass. But have you known anybody that's had a gastric bypass?
No, but I'm willing to try.
Yeah. No, you just have to work out. No, I'm not recruiting you.
I had this discussion with my wife. If we could just afford a bypass, I'd be fine.
Now, you won't like what I'm going to talk about. Okay?
Okay.
It is, a lot of people have noticed that after having bypass surgery, a glass of wine or alcohol affects them much more than it did. And does that make any sense? And
you mean they get drunk faster?
Yes. And if that's your goal, but that'll save you a lot of money on buying a second bottle.
Sure.
But in fact, the effects of alcohol are nearly doubled in people who've had gastric bypass. And many times where food had been an addiction, the alcohol becomes an addiction. Gastric bypass is one of the most common types of bariatric surgery today in the United States, and it helps you reduce your food intake by creating a small gastric pouch that doesn't hold nearly as much. And most of the contents of the stomach is bypassed, and the digestive route of food directs it into the middle section of your small intestine, and that helps you lose weight by limiting the amount of calories that you consume and absorb. This direct route to your small intestine, which allows your body to absorb alcohol more readily and a lot faster. So your gastric pouch is unable to break down the alcohol as effective as the old stomach would have. In addition, your body weight is likely much lower than it was before. So your surgery, so you get a higher dose of alcohol per pound. So if it's been effective at you losing weight, it's also going to be effective at getting you inebriated quicker. And it could possibly cause that obsession to have you want more alcohol. Several studies compared alcohol concentrations in women who'd undergone gastric bypass with those who hadn't. And the study showed that for women who had the operation, blood alcohol concentrations peaked sooner and approximately double the level of those who hadn't had the operation. So women who had the procedure also felt much more inebriated for longer. So in answer to the question, is that real? For you, having 2 drinks is the equivalent of having 4 drinks, at which point you're likely above the legal limit. So it's an important limitation to keep in mind for your safety and that of others. And I know a lot of people, and some people in my immediate family who've had gastric bypass. Some of them have been effective, some of them have not. Females have a tendency to gain back that weight before the male does, and a lot of people, because of that, because their stomach stretches and they don't get to that point. Some have had different bariatric surgery other than the bypass, which makes the content of the stomach smaller, and this has to have other than the gastric bypass will alleviate a lot of that problem. So again, what happens is that before the bypass, the food enters your stomach and passes into the small intestine. After the surgery, the amount of food you can eat is reduced due to the small stomach pouch, and it's also redirected, so it bypasses most of your stomach and the first section of your small intestine. So food and alcohol flow directly into the middle of that small intestine, and yes, it can certainly affect the toxicity of a drink of alcohol, 2 being equivalent to 4, and your body weight being less than it was in the beginning is now becomes a problem. So it's something that maybe they don't educate you enough when you leave the hospital, because it's becoming more popular. It is becoming the surgery of choice in many people who don't want to diet, like my friend here across the podium from me, who has.
It's not really that I don't want to diet. It's just I'm so happy with how I eat now.
Yes, but will you be happier when I got home?
I'm hoping that when I am done with my sleep study and I get my CPAP machine and I can sleep better, that'll give me some encouragement and some energy to want to go out and diet and exercise a little bit more.
Well, I got home about 4 o'clock yesterday, and I turned on Dr. Oz, and Charlie Sheen was on. And Dr. Oz was, and I'm not a Dr. Oz fan, but he was talking to him about if he continued lifestyle the way he was, what his organs were going to look like, his liver, his arteries, his heart. One of the things Charlie Sheen quit doing after he was diagnosed with HIV was taking his medicine.
Oh, really?
His blood count now is 100 times what it was then. The inflammation has gone up considerably. And if he starts drinking again and keeps off his medication, he's going to die.
Wow.
He has that option. And at the end of this show, Dr. Oz said, I'll follow you, and I'll do the blood tests. I'll keep up. He says, my field is cardiology, but I will. So he showed him a diseased liver and what his liver was going to look like, which takes all the stuff from fats and all the waste products out, and it couldn't no longer do that anymore if he continued doing it. It showed how the arteries were filling up full of fats and high cholesterol, and the diameter of the blood vessels was getting smaller, so he would be more of a chance of having a heart attack or a stroke. At your size,
great. Thanks for the positive.
Well, at your size, you still can attain it by exercise and diet.
Yeah.
And you can eat the kind of a diet that fills you up. You used to do that. You were eating the right kind of stuff, and I was really amazed you could stick to it in a house full of family that expects to have more carbohydrates.
Sure.
We saw a thing on sugar yesterday where sugar becomes carbohydrates and becomes the new death threat now if you eat too much sugar. I luckily am not a sugar eater. I just don't. Desserts and sugar type things don't affect me. But now I guess it's time for me to get off the air. My phone's ringing.
It's a little reminder there from beyond.
Anyway, I've had good luck of being able to lose weight, and not always the right way.
Sure. Because
of my health conditions. So I'm just telling you, I think the world of you. I think that one of the chances for you to get better is to lose that weight.
Oh, yeah, for sure.
And I know your wife will work with you if you do.
She will give me lots of hot soup. And
you're just getting back, getting ready for the athletic season again.
Yeah, basically.
And you have a chance to. Did you do any exercises with the guys when you got together?
We actually scrimmaged and actually played and ran and did the whole thing as if I was a real player.
Didn't die, or?
I did not die. No. Didn't even really get. I mean, I was winded a couple times when I ran. Not horribly, but was kind of surprised I still had something in me.
Yeah.
See? But it was a lot of fun.
You could probably get on a team now if you.
I might, or I've considered it before. Probably not fast enough anymore. I'm not very quick.
Look, remember the people that you're playing with are
maybe,
the same age as you are.
Sure, maybe.
And you have the skills, and you know what the things are that you're supposed to do.
Yeah.
I mean, at one time you wanted us to get on a treadmill here and do the whole show on a treadmill. I challenge that to you right now.
Well, there is an exercise bike downstairs.
Yeah, well, yeah, but it only takes one. This isn't one of those bicycles built for two.
No. This one's about probably 30 years old too.
So maybe I could have you. That would keep you awake. Be on the bicycle for an hour.
My bicycle.
I mean, before
to ride my bicycle.
Jesus. Well, yeah, we don't want to serenade you while you're on there, but and we don't want you to have to be taking antipsychotic medication at the same time.
Can you cheer me on while I'm on it?
Well, oh yes, I'll even have people call in and say, "Good
job,
boy, Paul." Yeah. But I mean, you're young. You're at the point where you're not hurting so bad that it's going to kill you to do it, and you'd be amazed. True. You'd be amazed when you lose that weight.
Well, there was an article recently that said if you drink, you could lose, 14 pounds in 72 hours if you just drink spicy soup broth?
Well, you can, but you have to keep it off.
Yeah.
And that's the problem with those quick diets is it'll come back a lot faster.
Sure.
It's a whole different way of life. I have a tendency to like carbohydrates, and I don't eat much during the day. And then I come back and start eating at nighttime, which is the worst time, and the wrong foods because I like a steak, I like fries, but I also like fish. And if I can get my partner who's waiting for me out there to eat fish and chicken with me, which we've done before, at 500 calories. But again, on a reduced calorie intake like that, you have to be really sustainable in lower doses and lower portions. Well, we're out of time. I'd like to remind you we're NorthLake Medical Pharmacies with 2 locations for you at 5136 Hill Road East across from Sutter Lakeside Hospital. Call us there at 263-6192. And outside the Bruno, Shop Smart at 347 Lakeport Boulevard. Give us a call there at 263-1328. And aloha, Paul. I'll see you in a week.
Yeah, bring me, I don't know, a little tiki thing that'll give me bad luck.
Well, I had ordered some cabin girls, but unfortunately my partner said he was going to go down to Walmart and pick them up and bring them up to me.
Okay.
But I said I wanted to see pictures first.
Sure,
so,
absolutely.
Yeah.
All right, we'll see everybody back here again in 2 weeks, but we do have a pre-recorded Health Talk next week, so we hope you join us for that as well. And Bill, have a safe trip, and we'll see everybody back here on Health Talk, AM 1270 and 96.5 FM KXBX.
Thank you.